My name is Lindsay Wills. I'm from Mountain City, Tennessee, and I was an athlete in high school. I played softball all 4 years. I was an all-conference player, and I was an MVP with a Golden Glove and Silver Slugger awards. So very accomplished, and then I hurt my knee my senior year of high school, and I had 2 surgeries from that. And the surgeon that I had, he did a fine job on my knee, but then he didn't think there was anything else he could do to fix my problem with pain. So I decided to get a second opinion with Dr. Parker, and from that he went in, scoped my knee originally the first time, and he fixed the bone and anything else he saw, the scar tissue. And then after that I developed compartment syndrome, and he went in and did a 4-compartment release to go in there and release all that pressure so that my leg can have all the swelling room it needs and not be constrained, to prevent it from losing its pulse or its color, and to prevent the numbness that I would experience. So as a nurse, you're basically on your feet for 12, almost 13 hours a day. And when you're on your feet for that long, the blood starts to pool in the bottom of your leg. And then if you have a leg that doesn't pump that properly or has muscles that don't contract properly, so if you have a leg that's ambulatory and works and has full range of motion with very minimal pain and swelling, I feel like you can do your job better. After my first visit with Dr. Parker, he referred me to Breakthrough Physical Therapy. And the therapist I've been seeing at Breakthrough Physical Therapy is Mark Powell. With Mark, we work on strengthening, mobility, and balance. With the mobility, we do the Boost anti-gravity treadmill. And what that does is you get in and it inflates and it'll hold your body weight. So you're not putting as much impact and load onto your extremity that can really cause you more pain and discomfort, and helps to strengthen that as well. And then we did the lights over on the side, which is a balance exercise. You can do different difficulties for different lengths of time. So that really focuses on getting you twisting and moving and up and down while still balancing and focusing on the core muscles and the strength around the skeletal muscle in the bone of that leg. And then we do a lot of manipulation to make sure that your muscles don't, if your muscles get real tight, then your joints get real tight, and to keep that movement and fluidity, because I still get a lot of swelling. So you have to keep all that fluid moving, because if it gets stationary, then everything gets stiff and it's harder to move. Dr. Parker's great. Could not ask for anybody better. He never talks above your head, and if I have any questions, he's very good about taking the time to answer what questions I have and make sure that I'm clear on what treatment plan is going to be coming next. And he always gets back to me if I do have a question within 2 or 3 days, and he's a great doctor to see as a patient, and he's also a great provider to work with.